The modified pen grasp, using it for an exploratory stroke, you will keep the index finger in the C shape, as you learned in Clinic 1 and in Preclinic. When we're looking at using a calculus removal stroke, the index finger cocks back slightly, and the first knuckle on the index finger tends to be more flat. This allows a greater surface area on the front part of the index finger to be placed against the instrument, which allows more pressure and greater control of the instrument. As we take the instrument to go to an extraoral fulcrum, we're going to first start on the side that's closest to the operator. We'll place the back of the knuckles on the side of the face, on the same side of the tooth that we're going to be using it on. We place the instrument against the side of the tooth with the proper angulation supragingivally. Then we gently place the knuckles against the side of the chin or the side of the cheek. We're going to be using the back of the knuckles as our fulcrum, so we'll need to apply pressure against the side of the chin or the side of the cheek. In order to begin the stroke, we'll use light exploratory strokes, again with our modified pen grasp with the index finger in a C shape. Once we detect calculus, we're then going to be moving into our calculus removal stroke, which changes the modified pen grasp just slightly, making the index finger first knuckle flat and the index finger cocked back. You will be using wrist activation motion primarily as a source of power for this instrument and this fulcrum. You'll notice that the thumb is flexing slightly. This happens because as the instrument is being rolled to gain access to the interproximal area, we need to roll the tip of the instrument with the thumb. If the thumb is not rolling the instrument will come off of the tooth surface and will cause tissue trauma. Next, we'll look at this from the lingual view. Going from the lingual view, the operator will adjust himself or herself appropriately to maintain neutral wrist position. The instrument is again applied to the side of the tooth surface at the appropriate angulation supragingivally. Then the knuckle placement happens on the side of the face. You'll double check your neutral wrist and then adjust your body appropriately so that you're sitting in a comfortable position with the shoulders relaxed. Again, going through an exploratory motion with the instrument, using the modified pen grasp with the index finger in a C shape. Then once calculus is detected, you'll engage the index finger into the first knuckle will be flat, and you'll use your calculus removal stroke. The primary motion with this fulcrum comes from the wrist. You will have some finger action or digital action of the thumb in order to maintain the rolling of the instrument. Position of your hand against the side of the cheek or the chin will be dependent upon how wide your patient can open. People who can open wider will be in a different position than people who can't open as wide. This stroke is very effective in removing calculus on maxillary molars, particularly in deep pockets.